You're listening to an Ono Media podcast.
Good morning, and thanks for joining me for Rise in Crime, your morning caffeine hit all about crime. I'm Mama Jules, and our first story today involves an update to a court case where women say they experienced horrific abuse at the hands of their trusted OBGYN. And just a bit of a warning here. I have purposely chosen specific words to describe this abuse because I know some of you listen with small children near, and some of the clinical terms might produce a conversation that you aren't ready to have with a less developed child mind. Also, many examples are given of perceived sexual abuse, so a warning there as well. All right, let's get into it. Dr. David Broadbent was a family man. He married his wife in a Mormon temple in Arizona, and he began his practice in 1974, setting up his office on University Avenue in Provo, Utah. He graduated from the University of Utah, so that's just about an hour north of his new office space. And just like the University Avenue address of his medical practice implies, the office is within walking distance of Brigham Young University. But this is a unique situation. The religious university is populated with thousands of women who have had very little sexual experience. So if they choose Dr. Broadbent as an OBGYN, they may be unfamiliar with allowing a man to touch them in intimate areas. They also most likely have yet to find a voice because of little to no experience or exposure to those private experiences. And it is possible that the allegations of abuse took so long to come forward for this exact same reason. The women who were abused have been kind of encouraged in their religious culture to keep such matters a little more private. But that all changed a few years back when a woman chose to go on a public podcast called Mormon Stories and share her experience with Dr. Broadbent. Now, I'm going to refer to all the women in this story as Jane Doe and then their initials. Even though some of them have made their identities public, I don't feel comfortable using my platform and sharing their names without their consent. So, after Jane Doe shared her experience on that podcast in December of 2021, 3 other women connected with her, saying they had also experienced similar forms of abuse from Dr. Broadbent. Now, the 4 jointly filed a lawsuit, but in the weeks that followed, 46 more women joined the lawsuit. Then, 33 other women filed an additional joint lawsuit against Dr. Broadbent. One of the original women, known as Doe BB, said she went to see Dr. Broadbent with her husband. She'd scheduled the appointment in 2018 because she was at that time approximately 13 weeks pregnant, and she had chosen Dr. Broadbent for her OB care. She told the Salt Lake Tribune that he asked her when her last pelvic exam had been performed. She told him the procedure had been done just a few months prior. She said Dr. Broadbent suggested he could do a pelvic exam just to be safe. Well, she declined, saying she did not want one. Despite declining, Dr. Broadbent handed Doe BB a gown and told her to change into it. Confused, Doe BB complied, and she was rationalizing that he was the person in the room that had authority and that she should comply. She said when Dr. Broadbent returned, he, without any notice or explanation, began digitally examining her. She said she left that appointment feeling violated, and she immediately switched to a different OBGYN. She claims in the lawsuit that for months following the appointment, she would have nightmares and then would wake and kind of question her feelings and thoughts about what Dr. Broadbent had done. She said she suffered from self-doubt, telling herself she was just being dumb. But the feelings of violation kept surfacing. Now, another of the original plaintiffs chose Dr. Broadbent because he was so close to her BYU housing. Doe AS was experiencing some uncomfortable itching in her female areas, so she chose the doctor for proximity. She claims in the lawsuit that Dr. Broadbent spent very little time reviewing the reason for the visit and instead spent several minutes educating Doe AS on how to perform a breast exam at home. Doe AS says the whole experience made her feel very uncomfortable, but she felt at the time that she was just supposed to trust a doctor and she didn't know how to get out of the situation. He did prescribe her something for the itching, and she left the office. Now, another woman filing suit visited Dr. Broadbent back in 2008. She had chosen Dr. Broadbent for her premarital exam. Okay, that might be a weird term to some people, but remember, I told you that many of the women who are scheduling for this specific exam have never had sexual relations. Well, this was the case with Jane Doe SP. She also chose Dr. Broadbent for his proximity to her apartment. Now, when the exam that Dr. Broadbent performed included a vaginal and rectal exam with his fingers and was also performed without explaining what he was about to do, well, Jane Doe SP was shocked and horrified. Jane Doe SP had been told her whole life not to question a man in authority, and so she told herself this must be normal. However, she just couldn't shake the feeling that she had been violated. According to the woman, when Dr. Broadbent finished the invasive and lingering exam, he removed his gloves and allegedly said to her that her future husband is a lucky man. Now, she says he also gave her unsolicited tips on how to have sex. Well, following the exam, Jane Doe SP never told her fiance or talked about it with any other woman. But once she visited a different OBGYN's office in the following years, she finally felt that validation, knowing that not all exams are performed the way Dr. Broadbent performed that exam. Now, another woman who joined the lawsuit said that back in 1996, she visited Dr. Broadbent for just a routine yearly exam. Jane Doe WD said the exam was filled with physical pain and also humiliation. She alleges that when the exam was finished, Dr. Broadbent said to her, "I bet your boyfriend really likes those tan lines." Now, Jane Doe WD says she has not seen another male OBGYN since that visit. And she also said she is so traumatized that her husband joins her for all of her yearly visits. Other women stated that Dr. Broadbent also made inappropriate comments like, "You're so attractive that I know your husband won't be able to keep his hands off you on your wedding night." And then another comment about how pretty and pink her sexual organs were. Another woman said that Dr. Broadbent leaned his face within inches of her pelvic area and then stated, "Everything smells okay." Another woman said that Dr. Broadbent asked her probing questions about her sexual history and then flatly stated that he didn't believe she was a virgin. He then said he can tell when a woman is a virgin or not, and that multiple patients have lied to him about their sexual history. All right, for me, one of the most disturbing accusations came from a nurse who was lying in a hospital bed on the verge of delivering her own child. She states in the lawsuit that when Dr. Broadbent walked into her hospital suite, she quietly said to her husband and to the attending nurse, "Don't let him touch me." See, Dr. Broadbent was the doctor on call and her regular doctor was unavailable. This woman claims she had good reason to ask that he not touch her. She said just 3 weeks earlier, while working as a nurse at Timpanogos Hospital, she said she had witnessed Dr. Broadbent ignore the cries of his patient who was having a traumatic birth. The situation had bothered her so much that she had warned Dr. Broadbent that she would report him to the chief of obstetrics at the hospital if she ever witnessed his behavior again. Despite her concerns, Dr. Broadbent was the attending physician who delivered her baby boy. When the birth was complete, she says Dr. Broadbent told her that he had to manually deliver her placenta. She said the manipulation caused her severe pain. When he was finished, she said he stripped off his bloody gloves and gown, throwing them on the bedside table. He then allegedly looked at her and asked, "Are you going to write me up now?" I have dozens of other situations I could tell you from this lawsuit. Times when Dr. Broadbent allegedly told patients to sit still and let him do his job, or times while performing the lingering digital exams, Dr. Broadbent would allegedly ask invasive questions of the male partner in the room. Things like frequency of relations and positions used during those relations. I could go on and on, but I think you get it. Now, Dr. Broadbent has always categorically denied the accusations. 2 years ago, he told the Salt Lake Tribune via his attorneys that he could not discuss the case due to medical ethics, but that he is not guilty of any wrongdoing. Now, this case has grown far past finding justice for women that felt like they were sexually abused by Dr. Broadbent. After the 2 lawsuits were filed against Dr. Broadbent, Intermountain Healthcare, Utah Valley Hospital, Mountain Star Healthcare, and HCA Healthcare, all of those people were defendants. Now, those entities filed a counter motion asking the judge to dismiss the original lawsuits. Now, the various defendants argued that the women should have taken procedural steps required by the Utah Healthcare Malpractice Act before actually going to the place of suing the 5 defendants. Okay, here's the problem with that. That Malpractice Act references practitioners that basically screw up with their learned skill. Okay, for example, they prescribe a harmful dose of a medication, or maybe they left a sponge in a sewn-up surgical wound, something that has to do with the actual medical care. But the attorneys for these women have one response to this. Sexual abuse is not healthcare. See, they believe that unnecessary fondling or forceful examinations are sexual abuse. There is no reason to reference the Malpractice Act because the allegations have nothing to do with medical care. Now, the attorneys in a statement said that Dr. Broadbent's actions are deserving of an orange jumpsuit, not the protection of a white coat. Originally, the 2022 lawsuit filed by more than 80 women was not successful. Judge Robert Lunan dismissed that civil case on the grounds that it should have been filed as a medical malpractice, like I explained before. Now, this left more than the defendants unhappy. Lawmakers recognized the weakness in the Malpractice Act, and they amended the statute to specifically exclude sexual assault. But that didn't help the abused women. The statute was not retroactive. The plaintiffs appealed Judge Lunan's ruling. And finally, on Thursday, Utah's highest court reversed that ruling and resuscitated the lawsuit against Dr. Broadbent. It wasn't without unusual circumstances, though. Only 2 of the 5 justices participating in the ruling that came out on Thursday, only 2 could actually participate. 3 of the judges had to recuse themselves due to connections to the lawsuit. So instead, 3 other court judges heard the argument along with the 2 Supreme Court justices for the state of Utah. One judge explained that not all actions by a practitioner fall under the umbrella of healthcare. That judge likened the alleged sexual assaults to a doctor stealing the patient's wallet during an exam. He said the medical treatment is occurring, but the crime is also occurring and it doesn't relate to the medical treatment. So this is just one step for the plaintiffs. The amended lawsuit has had life breathed back into it, but the women must now prove the abuse happened. Also, everything I have explained to you is part of a now amended joint civil lawsuit. Dr. Broadbent, back in June of 2024, was criminally charged with forcible sexual assault, and that criminal case is still pending as well. For those criminal charges, he could spend 15 years in prison. Again, he denies the criminal charges as well. Now, Adam Sorensen, he's an attorney for the women. He told Law and Crime the following. The Utah Supreme Court's decision today affirms everything these women have said from the beginning and tells every person in Utah that sexual abuse by a healthcare provider never has been and never will be healthcare. He then went on to state, it is difficult to describe how good it is to hear that from our highest court, but any joy I feel is nothing compared to the affirmation felt by the women who suffered sexual abuse, the women who were told it was just healthcare, the women who have fought for years, and the women who can now say that the law in Utah is on their side on this important issue. All right, you're probably asking, what did the hospitals do? How did they respond to the lawsuits? Well, according to the attorneys for the plaintiffs, the response by the hospitals was not swift enough. They said the following in the amended lawsuit. Multiple formal and informal complaints were made of Dr. Broadbent's acts of sexual abuse, but neither IHC or Mountain Star properly responded. In fact, formal complaints made it all the way to the chief administrator and chief medical officer at Utah Valley Hospital. And yet, over a decade later, IHC was still referring women to go see Broadbent at his private clinic. All right, that was the plaintiff's response. But the two hospitals, Utah Valley Hospital and Mountain Star Healthcare, say they cut ties with Dr. Broadbent after the lawsuit received public attention, and that they basically forced Dr. Broadbent into retirement. In a statement, Mountain Star Healthcare said, "We sympathize with and fully support any individuals in the recently filed lawsuit who may have experienced this alleged behavior at the physician's private clinic in Provo. Like hundreds of other physicians who practice privately in our community, this physician is not employed by any Mountain Star hospital. The physician is not currently authorized to see patients at our facility. Over the years, this physician has seen a small number of patients at each one of our facilities. However, to our knowledge, there were no allegations of inappropriate conduct reported to our facility regarding this physician." Okay, I'm going to stop the statement right there because clearly the plaintiffs do not believe that what Mountain Star Healthcare is saying is actually accurate. They have very different stories here. Okay, here's the rest of their statement. "While we empathize with the people involved, we believe we were inappropriately named in this lawsuit, and we will defend ourselves accordingly." Well, Dr. Broadbent's license to practice medicine is currently on hold. He voluntarily agreed with the Utah Division of Professional Licensing to temporarily suspend his professional license. This after the division and Provo Police Department received multiple complaints about alleged actions between the years of 1995 to 2019. Okay, while doing the research, I did find an interesting side note, so I'm going to tell you the story. Despite more than 300 women registering complaints of sexual impropriety by Dr. Broadbent, Utah Valley Magazine listed Dr. Broadbent among the best of the best in their 2024 issue that was set up to highlight outstanding businesses and physicians and entrepreneurs. Okay, here's how it works. Businesses and individuals are selected in various categories, and then readers vote for their favorite business or individual, and then the magazine awards the top 3 in each category. It's like a best of best that the magazine puts out every year. Well, Dr. Broadbent was chosen as 3rd best in the infertility practice category. Okay, all of this happened in 2024. Right after the issue came out, he was criminally charged. So just a bizarre choice here by Utah Valley Magazine. Okay, after online subscribers mounted a cancellation campaign, the magazine apologized and agreed to remove his name from their online list. Now, the magazine's founder said that there has been occasions where they have removed a winner after it was revealed the online votes were potentially fake or manufactured, maybe like from Russian bots. Now, some have theorized that friends and supporters of Dr. Broadbent mounted a PR campaign to help him get enough votes to receive 3rd place in that category. The founder of the magazine said she and her staff had checked to see if Dr. Broadbent was still practicing, and they noted that his license was in a state of suspension and had not been revoked. So therefore, they let the vote stand. She said the following: "We care about our community and all of its residents. We care about women and believe their stories. We understand that adding this subjective element to our voting process will provide a needed safety net so that we are truly highlighting and promoting the best of Utah Valley." All right, you guys, I think it's fair to say this civil and criminal case, they have people in the Provo area of Utah divided. I'm going to keep you updated on how this all turns out. And now to Virginia, where a registered nurse has been missing since July 31st. And this case has all kinds of questions surrounding the timing of the last day 28-year-old Mamta Bott was last seen. All right, here's the weirdness. Mamta's husband didn't report Mamta missing until August 5th, but she was last seen on July 31st. And the couple, they have a young daughter, like under 1 year old young. Then another weird point. Mamta doesn't own a car, so she didn't voluntarily leave via automobile. And the husband cannot provide a clothing description for his wife. Mamta's husband has been a no-show at vigils, saying he is staying away because he needs to care for the couple's 10-month-old child. WUSA 9 asked the husband why he delayed reporting his wife missing, and he responded with, "That's a question for the police." Okay, I'm staying neutral here. Maybe Mamta's husband tried to report her missing earlier, and the police wouldn't take the report due to the fact that adults have the right to disappear if they want to. I mean, clearly, it wouldn't be the first time we have heard of family being turned away when they are trying to report a missing adult loved one. All right, Mamta's friend told NBC Washington that Mamta would never leave her daughter. So let's give a description of her. She is 5 feet tall and about 130 pounds. She works at UV Health Prince William Medical Center. She has dark hair and dark eyes. Over the weekend, a Facebook page dedicated to finding Mamta was launched by her friend Nadia. She told WUSA 9 that Mamta was not an impulsive person. She explained she is a calm and reasonable person. The Manassas Park Police are calling the investigation active and ongoing. And they're stating that they were using several investigative tools in an attempt to help locate Mamta. So I would guess those tools include forensic audits of cell phone data, things like that. And often those parts of an investigation, well, they're not public. We don't get to see that that's happening. But one tool that does have a public element is ground searches. And from what I'm seeing, those aren't occurring. Maybe they don't know where to search, or maybe they truly believe she left on her own accord. So I'm going to leave it out there. If you have information on Mamta, you can call 703-361-1136. And now to a story out of Tennessee where social media can both unveil ugly behavior while at the same time encouraging ugly behavior. All right, this week a video was shared online where employees at Premier Dental Group in Knoxville, they're shown reading a patient's private journal aloud in a staff area. Now, the employee filming the reading is giggling about the patient's concerns. The journal entry is listing different kinds of treatment and the concerns that the cancer patient is feeling about those treatment options. Here, I'm just going to let you give it a listen and a watch.
Not for any more than any more two new ones, which are dermal, so they are not risking anything. I'm going to continue in the testing and the meds, but my views have not changed on treatment. I'm not going to do any dialysis, chemo, radiations, or infusions. I will agree to surgery, but it's to repair or correct. But I am not having anything removed unless they know what's causing the failure. But in my opinion, if they can't stop it, removing the bad parts will only leave the good bad sooner. If the failure continues, taking parts out is pointless if they don't know the cause. I am not sure if there are any other treatment options. If so, I'll make those choices as I go. If they are a lot, if it's this failure, it's all right.
Now, once this Snapchat video was shared online and received notable attention, the Premier Dental Group of Knoxville posted a statement on Facebook apologizing for a, quote, recent incident involving an inappropriate video created and shared by some of our employees. Well, 1 hour after that statement was posted, the Facebook page could no longer be found for Premier Dental of Knoxville. But the internet lives forever, fortunately and unfortunately, and screenshots of the post are available everywhere. Look here, I don't really see much, quote, wrong with the statement as far as statements go. It's super public relations, blah, blah, blah. Exactly what I would expect them to write. But you guys, it wasn't enough for people. Maybe Premier Dental Group was getting backlash because they mentioned they've talked to the employees, but it doesn't mention any disciplinary actions are being taken with the employees. And then my other thought is that possibly Commenters were encouraging people to boycott the dental office. So this might be one of the rare situations where publicity is not good for business. And maybe that's why the Facebook page is gone. Premier Dental has some baggage too. In 2023, the group settled a lawsuit that accused the dental group of scamming Tennessee Care and possibly putting patients in danger. Now, this lawsuit said the group used unqualified dental hygienists. It also alleged that the group was performing procedures that weren't necessary. If you want to do a deep dive on Reddit about dental offices and how they do fillings and root canals when they shouldn't, it's out there. You guys can go find it. So potentially that's what this lawsuit is about. Well, Premier Dental Group of Knoxville settled that lawsuit for $1 million in a payout to the plaintiffs. With the release of the video from Snapchat, the group could be sued for violating HIPAA. That's the Health Insurance Portability and Accountability Act. HIPAA is designed to protect information on a person's medical chart. But this isn't a little different. This was a patient's private journal. However, the read aloud passages are detailing her health journey with cancer, so it could fall under the law. Now, the Better Business Bureau reported that Premier Dental Group of Knoxville does have an F rating. They received that rating because the business's response to complaints is pretty much non-existent. WBIR in Tennessee reached out to the Tennessee Department of Health asking if there was an active investigation into Premier Dental Group. The department could neither confirm nor deny any investigation. They also said journalists would be able to access any records after an investigation is completed. That is, if one was started. Okay, here's my takeaway. My mother died from cancer in 2019. Almost everyone knows someone who has died from cancer. My heart was already broken by the disease that ravaged my mother's body for 5 years before she died. If I knew that employees were laughing at her private thoughts, it would have only wounded my heart and our family's hearts even more. I truly hope this patient receives better care from her cancer specialists than she was receiving at her dental office. All right, that's your Thursday episode of Rise in Crime. I love it that you guys are here. The community just keeps growing, so a big thank you. Thanks for being part of my day. If you're loving the content, I always ask that you share it with a friend, or there's lots of other ways that you can help us out too. Help the videos and the podcast grow by doing a 5-star review or leaving a positive comment. And you can like and follow on all of our social media and our YouTube accounts. We have 3 podcasts at Oh No Media. Of course, Rise in Crime, Into the Dark, and Murder with My Husband. You can join me again on Monday for more morning crime news. I'm Mama Jules, and keep safe out there.